Okay, what can cause overactive bladder? Diabetes, big one. This is one that doesn't get enough attention. Excessive glucose in the urine will lead to frequent urination. That's how a lot of times excessive thirst or frequent urination will lead to a diagnosis of diabetes in some people. Neurologic disorders such as a stroke, Parkinson's, Alzheimer's, things like that, that as I showed you, this process passes through the spinal cord and the brain. So if there is some brain pathology, there might be issues storing urine leading to overactive bladder. An enlarged prostate, a big one for men. I'll talk about it. Obesity. Why does being obese cause you to frequently urinate? It's because of the excessive girth or weight in your midsection pushes down on your bladder, causing you, like you're pregnant, to have to urinate frequently. This is something that doesn't get enough attention when we talk about, hey, what could help? Weight loss could help, but it's hard. And so a lot of times we'll just skip talking about these things that matter and jump straight to medication. But just as a reminder, addressing underlying medical conditions will help things like overactive bladder. Obesity also causes hormonal changes that will lead to frequent urination. Pelvic organ prolapse in women after they have babies. Menopause is a significant one that's only recently getting the attention that it needs because it causes overactive bladder in women after menopause related to estrogen deficiency in the urethra, bladder, and vagina. Obstructive sleep apnea is commonly not recognized as a cause of nocturia or waking up at night to urinate. So I'll ask patients, they say, I wake up too much at night to urinate. I'll ask them, has anybody ever told you that you snore? Yes. Okay, well, you probably should get evaluated for sleep apnea. And it doesn't really make sense why this is related to the patient. But what happens, you're not breathing and oxygenating adequately, and then the pressure in your right atrium will rise. Because of that, the body is sensing elevated pressure and will increase a diuretic hormone called AMP, which will cause you to diurese urine at night to lower your right atrial pressure. If you use a CPAP machine or get treatment for your sleep apnea, you will in general urinate less at night. Tobacco. The nicotine and chemicals irritate the bladder and cause you to urinate frequently, like do other drugs, ketamine, methamphetamines, things like that. Anxiety and depression and other mental illness can cause you to stress and worry a lot about urination, and this happens in teens and in young folks, and this can become sort of a cyclical kind of obsession or worry about having to urinate, especially in public places, and the fear of that, and it can sort of propagate itself. This is a slide just on BPH because it's such a hot topic for men and such an important topic. What is BPH? Again, I showed you the prostate was around the urethra in men. Women do not have a prostate. As men age, they can, and very commonly, will have proliferation of the smooth muscle of the prostate. You can see here, the urethra is open, and here, the urethra is pretty blocked. As you can imagine, it would be hard, even for bladder muscle, to push urethra through this channel to get out. Very common in men as they age. You can see the prevalences here. And like any muscle, if you're trying to engage a skeletal muscle, but I'm trying to lift weights, but there's something resisting my ability to do an arm curl here. But I keep trying. Over time, my bicep muscle is going to fatigue and become irritated and potentially even stop functioning. That is exactly what happens to the muscle around your bladder as it continuously tries to push against this obstruction. This leads to confusion because men will commonly come and present with urinating frequently, urgently, and with incontinence, instead of the more traditional BPH symptoms of having to strain to pee or weak stream, etc. So it can be confusing for us in men. Hey, do they have an overactive bladder or do they have a big prostate? But that's for us to work out with you, and we have ways to do so. Again, men may notice urinary frequency more so than weak stream. How does a urologist typically evaluate urinary frequency or overactive bladder symptoms? Again, you'll come and you'll report your symptoms. And it's extremely important for you to tell me, and more so for me to ask you, how much is this bothering you? Because like I mentioned earlier, this isn't hurting you per se. It's a quality of life issue. And is it bothering you enough that you want to do something? You want to try to lose weight. You want to try a medication. You want to try surgery. And if you tell me it's bothering you enough that you are willing to engage in those sorts of treatment options, then let's do it. If you say, yeah, I urinate 15 times a day, but it doesn't bother me. Oh no, I wouldn't be willing to take a medication for that. Then okay, let's do nothing. So your degree of bother is very important. And we do care. And a lot of times when you see a primary care doctor, they're dealing with so many things that the quality of life issues, such as overactive bladder, for example, are lower on the list of importance, and things like, cancer screening as well as diabetes, heart attacks, things like that are more important. And so a lot of times that's where we as the urologists can step in here as a consultant and really, really help and take the time to talk about these issues that a primary care just doesn't have time to talk about. We'll do some urine studies. We'll look for blood in your urine as well as an infection to make sure that this isn't a bladder cancer or a UTI or some other issue causing that. Medications can cause frequent urination, as I'm sure you can imagine. If anybody's ever taken Lasix, as you know, that are furosemide, that'll cause you to urinate frequently. Some diabetic medications can. We'll use a little bladder scanner in our clinic. We'll have you empty your bladder, and then we'll scan your bladder to see how well you're emptying your bladder. Are you obstructed from your prostate? Are you obstructed from prolapse? Are you not emptying all the way? Is that why you have to pee all the time? Is because you're always full? May do a pelvic or prostate exam. I don't do many prostate exams with my finger anymore. It's not that helpful, but for women, I'll frequently do a pelvic exam. A bladder diary. I'll show you what this looks like. This is very helpful in the folks that are willing to do this. And sometimes we'll do some fancy tests called urodynamics, where we can measure the change in pressure between your bladder and your abdomen and see exactly what's going on in your bladder, how much you can store, the pressure that's generated in your bladder, and how many times you're urinating and leakage and things like that. So some fancy stuff we can do. This is what a bladder diary looks like. It looks like a pain in the butt, and it is. On the y-axis, you see time of day. X, you see drink, urinate, and leakage. And so you can even do this at home. You don't even need this. You can just print one out from online and do a little study for yourself. But you do need a collection receptacle to measure your urine. Whether you want to use your own measuring cup at home, that's up to you. I have done that once. Just clean it afterwards. It's not that big of a deal. But what you would write in one column is everything you drank that day. Because again, this is very important. Are you urinating frequently because you're drinking 15 cups of iced tea? Well, then that's our problem. We need to cut down the iced tea or the alcohol or the coffee. And it may be not an issue with overactive bladder at all, just an issue with excessive intake. So write down exactly how much you drink and what it is, because some fluids are very irritating to the bladder, and I'll talk to you about that. How often and how much you're urinating for a full 24 hours. Again, we need to know how often, because if you're urinating every 30 minutes and only 50 cc's is coming out, again, I told you that the bladder should hold about 450. So this column here is very important to me. So this person is urinating, I think, about 9 times within 24 hours, so slightly over 8. But for low volumes, this is one normal volume here. So I would say this person, especially because they write they had urgency and leakage, that they do meet criteria for overactive bladder. So this is what a bladder diary looks like, and it's helpful for me to figure out what's going on.